Lots going on these days. Some good stuff. I'm going to put some of the, or Danny on my team is going to put the links that you all sent us into the chat box as well, so folks can access those. Okay. Well, I show 12:02, so we're going to get started. Hope everybody has lunch and is ready for a great discussion over their meal today. Thanks, everybody. Thank you all our panelists, and thanks to all the attendees for joining us this afternoon. I'm Delegate Brooke Learman, and I represent, with my teammates, Senator Bill Ferguson and Delegates Robin Lewis and Luke Klippinger, the 46th District in Baltimore City, although, of course, we work at the state level to pass and implement policies that affect the entire state. And I'm so thrilled today to have three professionals who are doing really exceptional things. Although we're all based in Baltimore, much of the work that we're doing is really best practices that are translatable to the entire state and other places as well. So really excited to learn and hear. Before we begin, I just want to make a few points about where we are today, why I think it's so important to host these types of briefings. I fundamentally believe that being an elected official is about more than passing legislation while we're in Annapolis, right? It's about being able to connect people to resources that they need, driving discussion about important topics, and advocating for change in multiple ways, including through discussions like this one. I've been, like I'm sure all of you, really inspired to see the action over the past 10 days in reaction to the murder of George Floyd. And I think it's so important that we speak about and understand and take action, not just in the streets and not just in the halls of Annapolis, but in discussions like this to talk about the issues that are affecting our lives, and sometimes and of course understanding the history of some of the racist policies that exist and are showing up in our public health today, and in the death counts and the infection rates among people of color with COVID. So I'm thrilled to be having this discussion with three incredibly thoughtful leaders in the public health and philanthropic fields. Government is really about reducing barriers to success and creating opportunities. And as we find ourselves in a huge epidemic and pandemic with unemployment filings going up and everybody hurting, I like to remind myself and to think about it as, we are all in the same storm, but we are not all in the same boat. And it is up to those of us who are in sturdier vessels to make sure that we are able to help all of those who are in vessels that are leaking. Usually those boats are leaking because of, oftentimes because of structural racism or other problems that have been encountered throughout our lives. So I'm thrilled today to talk about public health challenges, solutions, best practices, and where we find ourselves in Maryland and in Baltimore today as we face COVID-19. Our panelists are three amazing people who I have so much respect for. We have, of course, Dr. Lena Wen, who is an American physician and a writer. She's the former president of Planned Parenthood, a former health commissioner for the city of Baltimore, and an author of the book, When Doctors Don't Listen, How to Avoid Misdiagnoses and Unnecessary Tests. She's a visiting professor of health policy and management at GW, and she's also a columnist now for the Washington Post, right? Which is exciting. Matt Gallagher serves as the president and CEO of the Goldsecker Foundation, a Baltimore-based private foundation with more than $100 million in assets that focuses its grant making on community development, education, and nonprofit capacity building. He is also the co-chair of the P3 that Baltimore City and Hopkins and Maryland and Care First have all put together to help us get a handle on and treat people with COVID in Baltimore City. And so he's going to be talking about that as well. And finally, Fagan Harris. Fagan is the president and CEO of Baltimore Corps, an amazing organization that enlists talented people in public service and social entrepreneurship in Baltimore City. He co-founded the organization with Wes Moore in 2013. I still remember you coming to my office to meet with Stu Sims, and he pulled me in 2013 to talk about it. And he continues to set the organization's strategic direction and lead its dedicated community of staff, fellows, associates, awardees, visionary cause leaders, and partners. And he is here also to talk about an exciting new initiative with Baltimore City called Baltimore Health Corps that will work to do some contact tracing. So excited to hear about that. So without further ado, I think I'm going to turn it over to Dr. Wen to start. Lena, I'd love to have you kick things off and we'll move along. And each person's going to speak for 8 to 10 minutes, and then we're going to go through some of the questions that were submitted. Everybody who's on, if you want to submit your questions in the chat box, we will certainly get them as well and try to get through all of the questions that are submitted. So thanks so much for joining us today, and I'm going to turn it over to you, Lena. Thanks.
Right, wonderful. And thank you so much, Delegate Learman, for inviting us to be part of this conversation with you today. And especially, I am so happy to be here with 3 of my favorite people. Brooke, obviously, you and I worked closely together when I was the health commissioner, and I also had the opportunity to learn so much from Matt Gallagher over the years. And Fagan Harris is one of my, is a dear friend and someone who I always call upon for advice. And I'm so excited to hear more about the Baltimore Health Corps that he is now leading too. So I wanted to spend my portion of this conversation talking about 3 things. One is where we are and what we try to do in this country with containing COVID-19. The second is my concerns for where we are and where we will be moving forward. And then third, what we can do, because we are practical people. And so what it is that we can do as policymakers, as individuals, as we go through this next phase of this pandemic. So what we, in terms of where we are, now hindsight is often 20/20, and we can look back in time and say, well, back in late January and February, there was the opportunity. We had that opportunity at the time. Had we had sufficient testing, contact tracing, we could have been able to rein in the infection at the very outset. Now, we were not able to do this. And again, hindsight is 20/20. Perhaps we could say, well, maybe we couldn't have predicted the level of the outbreak at that time. But we do know that that social distancing was what we did that actually made a huge difference when it comes to containing the infection, not overwhelming our health system, but also early aggressive measures saved many lives. A study actually that just came out yesterday in Nature showed that if we did not implement these social distancing guidelines, that we could be now facing 60 million infections in the US. And you think about the countless deaths that would represent. And so the intention of that social distancing was to flatten the curve so that we do not.
Come back. Did she freeze for you guys too? Such as the Zoom webinar. Hopefully she'll come back.
Yeah, she did freeze.
Okay. Oh, all our internet access issues. I'll text her and make sure she knows. We'll give her another second, and if she might have to end up reconnecting. So maybe we'll move on to and just come back to her then. Oh, yep, there she went. So maybe we'll flip over. Matt, do you want to talk for a little bit about the work that you're doing while she gets back on, and then we can.
Yeah, absolutely. Absolutely.
Cool. Oh, wait, now she's coming.
Okay, we got her.
Oh, good. You're back.
I am very sorry about this. I think this
That's
is
okay.
Working from home.
Yeah, no, everybody has been there. Don't worry.
Sorry about that.
You were so quick.
Just suddenly quit for some reason, and before you know it, a toddler might walk in at some point too. But
yeah, no, you're fine. Continue, please. Thank you.
All right. Well, just to finish this first component is to say that unfortunately we have decided to reopen anyway, despite not having the capabilities. And I think as a result, we need to move towards a harm reduction approach, which is recognizing that there is going to be risk of virus transmission. We don't have a vaccine or even treatment on the horizon yet. And so in the meantime, we need to be doing everything we can to reduce the harm. So what are my concerns? Well, my concern, one of them is that there is this misunderstanding that reopening means that suddenly things are safe, when in fact, it's not. It just means there's no such thing as 100% safe. There's no such thing as 100% dangerous. There's only 100% safe if you do not leave your house or your apartment for years. And of course, none of us are suggesting that. If you are going to resume your daily activities though, whether it's going back to work or kids going back to daycare or resuming any kind of social activities, then there are things that you can do to reduce that risk. For example, we know that being in crowded indoor settings for a long period of time increases risk, but being outdoors, wearing masks, making sure that we wipe our hands, wash our hands, use hand sanitizer, et cetera, reduces that risk. So there are things that we can do, but I think there is that misunderstanding that we can now be letting down our guard when we really cannot. I also am very worried about disparities that I think, Brooke, you mentioned in your opening, which is that those who are most disproportionately affected already by health conditions will also be most disproportionately affected because of COVID-19. And in many ways, COVID-19 has unmasked these long-standing racial disparities that those of us in Baltimore know very deeply and very well. And unfortunately, we have to do so much more to ensure that that we don't have this disproportionate share of those who already face the greatest burden to continue to shoulder more from COVID-19. And then the other concern I'll mention is that science in this era has been muzzled and even maligned. I mean, even something like wearing a mask has somehow become a partisan symbol. And I really do worry about what that means for us moving forward. So what is it that we can do since we are practical people? Well, three things. One is that we should be ready for a surge in case it does happen, in case we see a surge with the rise in cases now, and in case we see a surge with the confluence of flu season combined with COVID-19 in the fall. Hospitals need to prepare now for when that happens. We certainly cannot run out of personal protective equipment like masks again. The second thing is we need to really build and stabilize our public health infrastructure. We need to provide testing, widespread testing wherever it is that people are. We need to specifically focus on our most vulnerable individuals, recognizing that for many people, social distancing is a privilege that not everyone has. I mean, I can't tell my patient to go isolate themselves for 14 days if they live in crowded multi-generational housing and may fear losing their wages. And so having plans in place for that would also be critically important too. Contact tracing, also very important, and we'll hear more from Fagan about that. And then the third thing that I would focus on is this concept again of harm reduction and messaging, that at this point, we need to continue our public education. We need to help our businesses, our schools, everyone to do things as safely as possible, recognizing that everything we do has risk, and critically not forgetting our most vulnerable. You know, we are where we are now. I wish that we were not here because there's a lot that we could have done to prevent our country from being in the position that we are in now. But given that this is where we are, we need everyone to step up and do even more, whether it's on messaging, helping each other, because this is a time that we are really all in this together. So thank you again, Brooke, for bringing us together.
Yeah, thank you. No, great synopsis of where we are and what we're thinking, what we're looking at going forward. I appreciate that. Thank you. Matt, I'll turn it over to you and I will share the screen so we can check out your slides.
That's great. Thank you very much, Delegate Lieberman. It's a great pleasure to be here. And this is the most intimidating panel I've ever been on in my life. You know, paired with Lee Nguyen and Fagan Harris, two of my favorite people. So it's my unique privilege right now to be involved with the Baltimore City Public-Private Partnership that was stood up at the onset of COVID. I think that if you think back to March and seeing some of the images that were coming out of New York, there was a tremendous anxiety about the potential fate that was going to befall cities all across the country. As everyone really tried to grapple with how to best respond to the conditions that were emerging all around the world. Here in Baltimore, we are blessed to be home to 11 hospitals, the state's 2 academic medical centers and Johns Hopkins University of Maryland, and we're also the headquarters of Care First Blue Cross Blue Shield for Maryland. And the CEOs of Hopkins, and Care First came together approached the city and wanted to stand up a public-private partnership that would really work to ensure that there was maximum alignment in terms of the resources and coordination in terms of our response to the many different elements of, COVID-19. And we thought this was particularly important because if you think about Baltimore, we have, the densest population in the state of Maryland. We have the highest rate of poverty, and we have high prevalences of, these multiple chronic conditions. And we wanted to really position the response in such a way that we were bringing everybody to the table and really maximizing all of the assets that we have. So I'm just going to hit a couple of quick slides just to give you kind of the overview. Next one, please, Delegate. Or do I advance it?
No, I did.
Okay. You can go to the next one.
Okay.
On the private sector side, we have Dr. Letitia DeRaza, who is the city's health commissioner. On the private sector side, it's myself. We've stood up 7 different work streams that have involved, creating a 24/7 call center with links to clinical care, regular public briefings and data dashboards so that the public can monitor what's going on. We've set up a lot of hotspot analysis that's going to feed into the contact tracing work. We have developed public testing sites as well as mobile testing capabilities. And then we've come up with very special plans to deal with, particularly vulnerable populations. Dr. Wen alluded to kind of multi-generational households that have difficulty isolating. We've had very special plans for the homeless population. Just thinking and trying to get ahead of the cases that are going to be the most difficult and most taxing on our healthcare system. Next slide, please.
Okay.
So right now, if you call, we hope you would call 211 if you need service, but we've taken the 911 call centers, the 311 call centers, the 211 call centers, and we've created a back-end system that people who have COVID-related questions and concerns can be put through a series of questions and prompts that ultimately end with a telemedicine consult and a potential testing referral or, a doctor's visit. Whether you're insured or uninsured, it doesn't matter. We have this 24/7 capability right now, dealing with hundreds of calls a day all across the Baltimore region. And the hope was to be able to meet people where they are, to provide them immediate access to some type of consultation, and then have an organized process to get people into the testing pipeline. Next slide, please.
That's quite a chart.
There's a lot going on there, but very quickly, we've been trying to communicate very regularly to the public with a series of public briefings that generally happen on Tuesdays and Fridays, where we're generally updating everybody on what's going on, what the daily and cumulative trends have been, really kind of the top line analysis in terms of case counts, positivity rates, fatalities. And then we've been really just trying to use these opportunities to emphasize different types of behaviors that we're trying to encourage or discourage, whether it's wearing a mask, whether it's socially isolating, whether it's avoiding large groups. It's been really important to consistently communicate to the public, from trusted sources so that they can get good, reliable, and actionable information. And speaking of that, next slide.
Yep.
If you go to the city's website, and I believe Delegate Learman has posted a link in the chat box, there is a wealth of information that is available and updated every single day on case counts, fatalities, testing rates, trends, demographics, capacity within our hospital system in terms of acute care beds, ICU beds, ventilator utilization. We've tried to be extraordinarily transparent to communicate the magnitude of the challenges and what the public and private sector have done to really position Baltimore in a way to be responsive to that. Next slide. We're synthesizing all of this data every single day so that we can identify outbreaks, we can make decisions about where to deploy mobile testing capabilities, which came online a few weeks ago, where to deploy what are called go teams, which are basically public health experts who are deploying into skilled nursing facilities and long-term care facilities to accomplish testing, to advise on isolation, and make sure people are getting the appropriate level of care. Next slide, please. I can't say enough about the work of the 11 hospitals in Baltimore City right now. We had the benefit of a little bit more warning than places like New York, but our hospital system, is updating information on an hourly basis in terms of bed utilization and all different categories of personal protective equipment, ventilator utilization. And we're able to track in real time just how stressed each of these facilities are. And thankfully, all of the hospitals in the city have been able to put in place surge plans that have brought on additional acute care and ICU beds to acquire additional ventilators. And we've been able to kind of flex based on what the public's demand is in terms of these types of hospital services. And while it's been very stressful on the healthcare system in the city, the hospitals have responded very effectively. And thankfully, we've been able to avoid a situation where we don't have enough bed space, we don't have enough equipment. It's a very significant management challenge, but the Hopkinses and the UMSs and the Mercies and the LifeBridges of the world have really done some excellent planning. They've been able to flex their resources in such a way that they can be very, very responsive to the needs right now. Next slide, please. And I'll come back to testing, but right now in the city, if you look at all the tests that have been administered all across the city of city residents, it approximates to only about 8% of the city population. So it gives you a sense that, testing has been a very, very real challenge. In the last couple of days, we've been able to get upwards of 2,000 tests performed each day in the city. And that's a combination of public testing sites that are available at Pimlico Racetrack and Druid Park and Lake Clifton. It also includes mobile test sites that we've been able to stand up with our public health partners. It includes activity that's happening at hospitals and private labs. We have to be able to know, what the positivity rate is, which thankfully has dipped below 10% in the city right now. We have to be able to recognize outbreaks in a timely fashion so that we can intervene in such a way to contain those outbreaks and really, keep us on a downward trajectory in terms of the caseloads that we're dealing with. Next slide, please. So these are some images of just some of the 3 public sites that have been stood up. We have mobile testing happening on the east side right now. We hope to bring mobile testing to the west side next week. We're making decisions as to where to put these locations to ease, travel times and make it as accessible as possible to the public. And then 2 more slides, that's it. Unfortunately, for those of us who've worked in Baltimore City and in Maryland for a long time, oftentimes Baltimore is on the wrong end of a lot of charts. And, while this has been a very, very challenging public health response, for once, Baltimore City is on the right end of some of these comparative charts. If you take a look at per capita fatality rates among like East Coast cities, Baltimore has been, considerably lower than DC, Philadelphia, and Boston. And obviously New York is kind of the epicenter of, COVID in the United States, but we've had relative success in Baltimore in terms of, managing this disease and this outbreak.
Yeah.
Next slide, please. And similarly, we are oftentimes as a city on the wrong end of the charts in the state of Maryland. If you take a look at the 10 largest jurisdictions in Maryland by population, and again, you look at fatalities adjusted for population rate, we're actually pretty far behind Montgomery County and Prince George's County, which is indicative of how significant the outbreak has been in the Washington, D.C. area. Right. But we have comparable fatality rates with Baltimore County. We are like kind of right in the middle of the pack, which given those kind of conditions I alluded to in the beginning in terms of poverty and density and the multiple chronic conditions, actually shows that we've been somewhat effective in our intervention so far.
Yep.
That's it. Thank you, Delegate. I'll turn it over to Faith.
Thanks very much. That was really illuminating and helpful. Certainly a lot of work and thought has gone into this, and I appreciate all the work that you've been doing on it. So thank you. And now I'm going to turn it over to Fagan, who's going to talk a little bit about sort of next steps in all of this, and the role of Baltimore Core and the partnership that you have stood up with the city. So excited to hear from you. Thanks for joining us today.
Thanks for having me, Delegate. I really appreciate it. And I'd be remiss if I didn't acknowledge Matt Gallagher as our board chair at Baltimore Core. He's been one of our fiercest, staunchest champions and supporters basically since our inception. And then Dr. Nguyen and I worked very closely together in the early days at Baltimore Core. I actually recall a DC conversation where we chatted about Dr. Nguyen moving to Baltimore. So
Nice.
I like to claim a little bit of credit that she's a Baltimorean now alongside us. And we established what has become a flagship partnership with the health department under her tenure. The big focus then, and that has continued, has been on the overdose epidemic. And now we're moving into the pandemic response very close to the Baltimore City Health Department. Baltimore Core exists to enlist our residents in the most compelling public service and social entrepreneurship solutions here in Baltimore City. As Matt indicated, a lot of times our city is on the wrong side of a lot of charts. I would say our city oftentimes is on the kind of the wrong end of a lot of conversations, and a lot of stigma and a lot of bias and a lot of preconceived notions, where a lot of people regard us as a dysfunctional city, a city that is just awash in problems. And what's often missed is how many assets we have here, how resilient our people are, the tremendous capacity to come together and solve big problems. And so Baltimore Core exists to help institutionalize that level of collaboration and that mobilization of our people to solve our biggest challenges. And we operate a range of programs. We operate a fellowship, we operate apprenticeships, we operate search and placement, all designed to help people get involved either directly in jobs in city government, jobs in the nonprofit sector, resourcing folks as social entrepreneurs or community leaders, working on special initiatives, all about how do we get our people working on the biggest challenges and really moving the needle. And so we have played a key role with the Baltimore City Health Department on standing up what we call the Baltimore Health Corps. And that Health Corps is going to hire up to 300 city residents in key pandemic response functions, most notably contact tracing. And I'll say more about kind of the criteria for that work and those workers, but I want to spend a little bit of time on this contact tracing piece. What is it? Why is it important? And why are we putting so many people kind of to work in this way?
Contact tracing. That is definitely the question that I've been getting recently. Like, what's contact tracing?
What the heck is it? Totally. It's a great question. The essential function of contact tracing is to help notify people when they've been exposed to this virus. And the hope is that when a human being can triage that and let someone know, that person on the other end of the phone, it's really important that they're a trusted person, that they're credible, that they're knowledgeable, and then they can help that individual who's had some exposure take then the right next step kind of in their care plan. So I was at jury duty in early March and started feeling feverish and didn't feel good and didn't feel well. And turns out I was one of the first people in our city to get COVID. Now, a lot's changed since March, but in a lot of ways, a lot hasn't changed. We don't know a whole lot about this virus. There's a lot of misinformation and disinformation out there. As Dr. Nguyen indicated, science has been kind of muzzled in this climate and maligned. And so people, based on a lot of their information sources, may not know what to do when they've been exposed to COVID, or may not know what to do when they've tested positive for COVID. And so what the city has done, and the Health Corps fits into this, is we need a no wrong door approach where people can get to good, relevant sources of information to help them take good, proactive next steps, whether they're calling into 311 or 211 or 911, or whether they're being proactively contacted by a city health official through something like the Baltimore Health Corps. You know, I remember when I came down with COVID, my primary care physician, I go to a community clinic, didn't have good guidance, didn't know how to advise me. And I did a lot of things that I've come to find out were probably not the right thing to do that then caused additional complications. And so I think it's very important for those of us who are kind of highly tuned into the information around this. That is not necessarily illustrative of the general population. A lot of people aren't necessarily obsessing about what's the right thing to do and when to do it. And so we got to make sure that everyone in our city and everyone in our society, if they're exposed or come into contact, can get good information and take the right next steps to protect themselves and loved ones. And so that is why we are marshaling a huge core of contact tracers. We're hiring that through our website at baltimorecore.org. You'll see the link in the chat box. Our focus is to hire 300 city residents. Our focus is to privilege those residents who have lost their job through the course of this pandemic. A lot of times you hear in the media this choice between the economic recovery and the public health response. Doing big New Deal style direct job creation, jobs efforts is a way to kind of blunt that criticism, frankly. There's a lot of employment that's going to be generated over the course and life of this pandemic. And it's vitally important that we look at that employment as an opportunity to advance racial equity, to advance economic opportunity in our most disinvested and hardest hit communities, and to help people who are looking at their economic and job prospects wondering, what the heck do? I don't have a job. Unemployment's at 14%. We're going through a larger economic transformation in this country. I might need to transition careers. Healthcare is on the ascendancy. This core is really designed to get people into those healthcare careers, to not just get them a job, but to get them 40 hours of training up front, to get them ongoing training through the life of the contract, which could run 8 to 12 months, and to make sure they have the coaching and support to transition into a healthcare career once we get through this emergency chapter. And so we couldn't be prouder or more pleased to help do this with the City Health Department. We've already had 1,000 people apply since we launched this initiative last Thursday. There's obviously tremendous interest, and encourage anyone you know here in the city to apply if they're looking for these kinds of job opportunities.
That's great. Thank you. It's a wonderful program, really imaginative. You know, once I heard about it, I was like, oh, of course, that makes a ton of sense. But you know, I know it's an exciting initiative, so it's great to see. So we had a number of people write in some questions, and there are some questions in the chat box as well. Again, folks, if you have questions for our panelists, feel free to write some questions in the chat box. There was one question in the chat box that the woman was, I was recently told that hospitals and nursing homes receive money for each recorded COVID death. This seems to make fraud an all too high possibility and tragic for families to not know the truth. Does anybody know if that is true, and is that like a wrong incentive? Any ideas on that?
I'm not sure what exactly this is referring to. I mean, it's, I don't know. I mean, some hospitals are reimbursed for particular diagnosis codes.
Right.
That may be what they're referring to.
What it means,
really,
yeah.
I mean, this is not different from any other illness. And I would say also that if anything, I think that there is an undercount when it comes to COVID-19 cases, that initially it was because of lack of testing, that we just didn't test and therefore didn't know. But I think the other issue too, unfortunately, back to the science being muzzled part, is that there are politicians who are purposefully not reporting data. For example, in multiple states, for example, in Nevada and Florida, only those individuals who are coded as being residents in the state are being reported. Well, what happens if you're visiting a Las Vegas casino or are visiting in Florida? Somehow those cases are not being reported. So I actually think it's the opposite issue, that we have significant underreporting.
That's interesting. Good to know. So there are a number of questions about health disparities and a couple questions about the Latino community. And I think you probably could see on your chart, Matt, that you put up briefly. And if you can see my Live Baltimore poster in the back here, in zip code 21224, that is one of the highest, that's where some of the highest rates of COVID have been reported. And 21224 is Southeast Baltimore and includes a large number of Latino immigrants in the city. And so there were a couple questions about, you know, how is Baltimore and how are the organizations that you mentioned, Matt, and others, if you want to talk about, doing work to ensure that we are getting data out to the immigrant community, and what are we doing to help stem the increase in problems and in deaths in the immigrant community? Would either any of you, and I will note for folks, we are going to have a special focus on the immigrant community and the effect of COVID on the immigrant community on June 30th with Gustavo Torres, the CEO of CASA, and Kathleen Page from Central Soul. But I just put this out there for you all to talk a little bit about your perspective of, you know, what we are doing and what we can do better to help the immigrant community.
Sure. Well, it's a great question, and I know in the chat box you put a link which will give like real-time data to people so that they can see you know, the very significant case concentration that is happening in Southeast Baltimore right now, particularly within the Hispanic population. We use that information to guide the decision on the deployment of the mobile testing sites. We also use that information to make decisions about expanding the city's isolation bed space capacity. There were a couple of things that happened early on in the COVID response where we took a look at the homeless shelters in the city, and we said, what are some opportunities to depopulate those shelters to allow for more social distancing among vulnerable populations? And initially, we stood up an emergency shelter that was going to be with a lower census so that we could you know, diffuse the clients across more buildings and give them more space. We brought on 300 hotel and motel rooms across the region so that clients who were under investigation or people who tested positive but had modest symptoms were able to isolate. And then more recently, we brought on a 400-bed facility at the Lord Baltimore Hotel to further expand our isolation capabilities. Right now, the city is operating the mobile test sites on the east side and in Southeast Baltimore. Hopkins is layering in additional mobile testing resources right now as well. And we have a very robust kind of information distribution network so that we're working through churches and neighborhood associations and business groups where the city, through what's called the JIC, the Joint Information Center, puts out bilingual, you know, fact sheets and flyers and Instagram, Facebook, and social media posts to try to reach people however they receive their information. We've made progress. We're not where we want to be in terms of access to testing, but the testing is free. You can go to a clinic, you can go to a mobile site, you can go to, you know, the 3 fixed locations in the city right now. You know, anybody who needs to get a test can get into one of these pipelines and we can get a test for you pretty soon.
Any other thoughts on that? Nope. So there were a couple questions as well about how people should best protect themselves, especially now that more people are out and about and also going to protest the marches. So I don't know, Dr. Wen, if you want to talk a little bit about you know, how can Marylanders be, how, you know, if we want to go out there and show support and solidarity and also protest, how should people be taking care of themselves? What should they be doing if they feel any symptoms? What symptoms should they be concerned about, you know, allergies versus coronavirus? Any thoughts on that?
Yeah, definitely. So, and I'd be happy to send around a link if I can, or once I finish talking,
sure.
I'll send a link to everybody, because I did a couple of articles about this. One, I'll send to everybody, is about assessing risk. Because again, everything that we do in life is going to have risk moving forward. Going to the grocery store has risk, but going to the grocery store has a very different risk than going to a crowded restaurant or bar with people and sitting there for 6 hours, right? And so how do you think about risk? I'll send out that article, but I'll specifically, I'll send out another article about risk during a protest as well. Let's think about where it is or what amplifies the risk for any particular thing that we choose to do. There are 3 factors: proximity, activity, and time. So the closer you are to someone, the higher risk there is. So if you think about in the context of protests, I know it's hard, but if it's possible when you're out in a protest to try to stay socially distanced as much as possible. You could do that in a number of ways. You could look up the type of protest that you're attending in advance, ask questions of the organizers, especially if you're somebody who is more vulnerable with chronic medical conditions. You might want to choose a protest where that social distancing is more possible. Activity is really important too, because we know that activities where you are shouting, where other people around you are shouting, screaming, singing without masks, that really increases the droplet transmission. And so you could, for example, if you go to protest, of course, make sure to wear a mask that protects you and others around you. And also don't share drinks with people. Bring your own drinks, bring your own food. So that reduces the risk too. If you're going to be handed a bullhorn or signs or something else, after touching it, then make sure that you sanitize your own hands too. And don't shake hands, hug, kiss. As much as we may be involved in the moment to do that, know that there is significant risk with those types of activities. And then there's the issue of time. So if you're outdoors, socially distanced for proper that's pretty low risk. But if you're going to be indoors for any length of time, know that any exponential time is going to increase that particular risk too. So try to reduce your risk by reducing that period of time. Now, I also think if you're, once you're done with that protest for the day, assess your risk for what happened during the protest. So your risk, again, if you're at a socially distanced protest, very different than if you were corralled by law enforcement or were arrested and put in detention for 6 hours in a crowded indoor space. If it's the former, not much risk. If it's the latter, you might want to separate yourself from others inside your home, especially if they're more vulnerable, and consider getting tested in a couple of days' time. I think, again, these are all harm reduction strategies. They don't protect you completely, but there are definitely things that you can do to protect yourself and others around you too.
Yep, that makes a lot of sense. Thank you. There are a couple of questions about sort of next steps in contact tracing and why we need it and how we will make sure that every community is covered by contact tracing. So I know in the description, actually somebody just posted it in the chat. Fagan, you talk about that you're going to make sure that the workforce is centered on equitable employment, and that will be representative of the demographics of Baltimore City. And of course, that's important for a variety of reasons, and would include, I would think, Spanish speakers to make sure that we're reaching the immigrant community. Do you want to talk a little bit about, whether the plan for who will run, like how the contact tracing, they'll be employed by you, but they'll be trained someplace, and how can people get involved, and how long do you expect the contact tracing plan to last? Is this a year? Is this 5 years? Is it 6 months? Like a little bit more details on how that fits into the overall public health response that the city is looking at. And do you know of other jurisdictions in Maryland and about how they're working on this? Just curious.
Sure. So we have been in conversation with Baltimore County and Anne Arundel County about similar contact tracing efforts. Our organization stands ready to kind of advise and support to help them stand up. And there's been discussion about even pooling training and making sure that we're kind of uniform in our approach. So I expect those jurisdictions to make kind of similar moves as we have here in the city. Because contact tracing, the efficacy of it hinges so much on being a trusted, credible messenger. It actually matters a lot that we get people from the zip codes here in the city most impacted by COVID. That also dovetails with a lot of the same communities that have just historically been disinvested, have struggled, have been on kind of negatively impacted by structural racism, low socioeconomic, you name it. And so we're being very intentional on our outreach to those communities, making sure that we have a lot of representation from all across Baltimore City, making sure that we have contact tracers that people feel affirmed by and believe are trusted and credible messengers. You can apply on our website. I see it's coming up and down here in the chat box. You can find the link there. My staff will help intake and guide people through that process. They will ultimately be employees of the Baltimore City Health Department. And they will be trained by the Baltimore City Health Department by a nonprofit called JAPIGO, which focuses on kind of public health training. They do that work all around the world and are headquartered here in Baltimore City and are using really good training curriculum. And then my team is kind of alongside all of those individuals to provide ongoing support. In terms of the life and duration of the program, we're making a 12-month commitment to this. So we expect that this will run through the first half of 2021. We're hiring immediately, so the application is open, and we're trying to get to that 300 number as quickly as we responsibly can. Again, making sure that we end up having a core of contact tracers that really look and feel like Baltimore City.
Right. That's
And,
right.
and yes, we are also looking for bilingual tracers, and we are looking for tracers from our immigrant communities and our Latinx communities. So that is also a huge focus for us.
Great, thank you. Good question on vaccinations. People are curious about sort of the resilience of the healthcare system and its ability to respond. A couple of questions. When COVID-19 vaccinations are available, do you have confidence that Baltimore's hospitals, and I'll add community health centers because they're such an important part of what we do, will be able to vaccinate people? Will the hospitals be able to keep up? And another question about, why are we seeing fewer people in the hospitals and in intensive care as we're going right now? Any thoughts, Matt or Dr. Wen or Fagan, on any of sort of about the resilience of our healthcare system in its ability to respond when there is a vaccination available, whenever that may be? You're all welcome to give your guesstimate as well on when that would be.
I can start and say that it'll take time, first of all, for a vaccine to be developed. The most optimistic estimates for the end of this year, I just cannot quite imagine how that could happen.
Yeah.
I think we're going to face the situation of having to live with COVID for some period of time. If we have this administration, federal administration, moving forward past 2020, I would be very concerned because they have not had a national strategy all along for things like procuring masks and tests. And I don't know how they would possibly have a national strategy for distribution of the vaccine, because it's not the vaccine that's going to save lives, it's the vaccination. So you need to have these swabs, you need to have the syringes, you need to have the needles, you need to have vials, then you also need to have people to literally administer that vaccine, which is not our healthcare system. It's not our hospitals. It's going to be community health workers. It's going to be people who are distributing them widely across our country. And it would be, again, difficult to see how we would do that under this administration when we still don't have a national coordinated strategy, even for something else like procurement of masks and other supplies.
A great point. Yeah, got to do all we can to get a new resident of the White House come November so that we can make sure that we confront the vaccination issue in a much more systemized way than we've confronted the PPE issue and the testing issue and everything else. You're totally right. Matt, any thoughts from you on the healthcare system and its ability to keep working together as we go through this?
Yeah, I think that it's been really encouraging as somebody who's had a lot of exposure to the healthcare system, from like a regulatory standpoint when I worked in state government, to have these different systems like the public system, University of Maryland, working so closely with the private system at Hopkins and some of these other large providers. The information sharing and the coordination has been very, very encouraging. And while there are many challenges in Baltimore, the fact that we have 11 hospitals here and very, very robust systems, there have actually been cases, like some of the trickiest cases in the state have been consolidated in Baltimore because we have so much bandwidth and capability within our hospitals that, when we reach like that great day when the vaccine is going to be available sometime in the future, I think we have a great infrastructure for the delivery of that through our, hospitals, our federally qualified, health centers. But then also you have other portals in terms of your pharmacies and you have your libraries. We have the infrastructure in place. And I think that while it's unfortunate that we've had to stand up this public-private partnership, I think it's flexible enough that it can be adapted and utilized to accelerate, the administration of vaccines once they're available. And, speaking on behalf of the partners, I know that there's a willingness to play a role in that so people can get vaccinated as soon as possible.
Right. That makes sense. There's also a question, Dr. Wen, what is the status of the accuracy of antibody tests and what can we gather from those results, if anything? This person notes that they've heard the Roche test is highly accurate. Is that the case, and will it be available? I know I've definitely had some constituents email me questions about the antibody tests and where can they get them, and are they accurate, and is it worthwhile to try to get one, even if it is available? Any thoughts on those tests?
I have a lot of thoughts about this, and one thought, which is do not get the antibody test right now. Please do not get it. And I hope that you'll join me in helping to spread the message of everybody else too. And here's the reason why. Most important is the reason that we do not yet know that antibodies confer immunity, meaning that if you test positive, that it will protect you from getting COVID-19 in the future. That may be the case, but we don't know whether you need a certain level of antibody, and we also don't know what this means. Is it going to protect you from getting severely ill or partially ill? Is it going to last for a year? Is it going to be 6 months? We don't know this. And the last thing that I would want is for somebody to take this test, get a positive test for the antibody and think, I've been exposed to this, I'm protected from getting COVID-19, so I'm going to let down my guard. And this kind of false reassurance is extremely dangerous because we don't have the science to back it up. So that's I think the most important reason. There are other reasons too, including that the antibody test is not reliable. There's some tests that have as high as a 50% false positive rate, which is basically flipping a coin.
Wow.
And so I would just advise that it's the antibody test used in a research study to figure out how many people in a population may have been exposed. Important, but not for your personal decision-making when it comes to whether to pursue another activity.
That's very helpful. And now I have my answer for constituents when they write to me about where they can get the antibody test. So we're about to wrap up, but I'd love, if you have final thoughts, maybe a minute on where we are, where we need to get to. And I had there was another question. You're also welcome to all of you answer. Advice for young public health professionals and community workers working to communicate COVID-19 news and updates to their members and the public. So as you're thinking about, the thing that you want people to walk away with and remember from this about the work you're doing, like feel free to share that and then we'll wrap up. Thanks. Fagan, you want to start?
Sure. Thanks again for having me and good to be with all of you today. I think the number one thing I would say is that our city has been incredibly organized around this challenge and is getting more organized by the day. And efforts like the Baltimore Health Corps are designed to get more people involved in that organization and in that effort. Very important to underscore, the Baltimore Health Corps doesn't require a previous background in public health. It is open to people from all walks of life. There's not a kind of a credential or a degree requirement or training requirement. The most important piece is to have empathy and to have connection to the communities hardest hit by this pandemic, so you can help us fight this pandemic back and also mute some of the devastating economics that has resulted from this virus. And so I really can't turn up the volume on that enough, that whether you're a public health professional, and we admire you and we thank you and we're grateful for you, and Baltimore Corps has a long history of working with you, or you're someone who's very new to the field of public health, but you feel called to get involved. The most important piece is to be empathetic, to work with our city leadership to kind of drive forward a coordinated and sustained response. I think the city administration has done an awesome job of kind of regularly communicating the state of where we are, and they do that every single day. And those are the right messages to amplify and to send out. Sometimes that's not super fun on TikTok or Instagram or Twitter or Facebook. It may be not the flashiest presentation or the presentation that's most engaged, but the core information is accurate, and the core information is going to help us save lives, and the core information is going to help us beat back this pandemic. And so that's something everyone can do, whether you're formally involved or not.
Well said. Thank you. Matt?
Sure. Thank you, Delegate. And very much appreciate your convening this group and kind of making this information accessible. Two things for those who are interested in working in community health and, really kind of digging in on these issues. There's no better place in the world than Baltimore to engage, right now. And Baltimore's really been blessed through the years to have incredibly innovative leaders in the public health space. And I'm talking about Dr. Wen, and I'm talking about people like Letitia DeRaza and Josh Sharfstein. There is an opportunity to just get amazing exposure to, have hands-on opportunities here and really to measure your impact in very, very specific ways. And Baltimore is a place that, you know, rewards commitment and, you know, excellence and engagement. And, you know, you can really move up in this field probably more quickly than you can in other places. So I highly encourage people who are interested to get engaged, because we need you right now. And this is a place where, you know, top performers can really stand out. And the second thing I would say is that, you know, and I've been saying this to a lot of people, you know, obviously this caught a lot of us off guard, and it was not something that we were prepared for. And in many ways, we've been digging out of holes, whether it's on PPE or testing. We don't really have a lot of excuses going forward. And when it comes to preparedness, and when it comes to like effectively coordinating a response right now, there are models all across the country and all across the world of cities, counties, states, countries that have done this well. And collectively, I think we have to raise our expectations, you know, of our public leaders, because, you know, the next time around, I don't think anybody should be able to get away with any type of excuse for the level of suffering that, you know, our communities have had to endure because of our lack of preparedness and our inability to execute. You know, this is what people should spend their whole lives training for, preparing for, and should be judged on going forward. So I hope that we can spend more time talking about these issues, and people realize that, you know, bad outcomes don't just have to happen, that we've got opportunities to intervene and successfully manage through these challenges.
Yep, well said. Thank you. And Dr. Wen.
Yeah, I saw there was a question from Lisa in the chat box too about if science is being muzzled, where can we find accurate facts? And I want to tie that answer to this answer about the conclusion, which is that, you know, really, I would have expected at the beginning of this outbreak that we would hear from our federal scientists who are the best in the world. The people who lead the CDC, who lead the NIH, who lead our federal governments, who are experts in public health and preparedness. This is their moment. This is the time for them to come and provide that accurate information and to be leading the response. They have not been allowed to do that. And that's why we've seen local and state officials really step up, private organizations, and again, Fagan and Matt, the work that they've been doing in this is amazing. Delegate Learman, your leadership has been incredible. I mean, we've seen so many people step up. And I think we've also seen public health experts who are outside of government step into this void, because we have not been able to have that coordinated central message from the federal government. But that's
Right.
what I want to leave everyone with too. Yes, we would much rather have this coordinated federal strategy. But in the absence of that, there are things that we can each do ourselves. It's not ideal, but it is where we are. And we have to remember that our individual actions have a huge role to play on our collective response and our collective well-being. So we talk about all of this, all of us being in this together. Well, there are things that we can each do to take responsibility too. And I hope that all of us will continue to keep up our guard, recognize that COVID-19 is a very serious public health threat, protect ourselves, and contribute to the well-being of our community as well.
Well, thank you. I hesitate to try to follow the eloquence of our three panelists today, but I just want to thank them so much for their work, for joining us today, for sharing their message. And then I do like to end all of these with a note of gratitude and humility, because we are all in our homes today. We are safe and sound, and there are many people who are on the front lines and have been throughout this entire crisis, who are not able, our farm workers, our transit drivers, our doctors, our nurses, our community health workers, our safe streets workers. There are so many people out there who are keeping things moving, and it's really, you know, we have to keep them at the focus, I think, of all of the work that we're doing to make sure that we are doing our best to meet the needs of the people who are often not heard from. So I know all of you are doing that, and I'm so appreciative of that. So thank you everybody so much for being on today. Stay safe, be well, and keep fighting for change. Thanks everybody, take care.
Thank you, Delegate. Thank you, everyone.
Thank you.
Thank you.
Appreciate
Thank
it.
you. Thank you. Bye.